Hi, it's Dr. Diegues. Now we're going to talk about shortness of breath. Basically, when you start having the difficulty breathing, that it could happen at rest, it could happen on activity, on exertion. This shortness of breath needs to be evaluated by a doctor. The question is that because of your lungs? Is it because of your heart? Is it because of being anemic and not having enough, basically, oxygen and hemoglobin on your blood? Um, so the question is always, what's the cause of the shortness of breath? Some people say, oh, it's because I'm overweight, I'm not in shape. And that's something definitely that could be an issue, but we need to always rule out more serious conditions. Sometimes the question is, can this be your lungs? Because as we discussed, could be asthma, could be COPD, could be pneumonia, could be fibrosis. But from the heart, you can have heart failure. You could be experiencing a heart attack. And there are different presentations of conditions from a heart process. It could be that you're losing blood and you don't have enough hemoglobin, and that's why you're short of breath. So always shortness of breath needs to be evaluated, and it needs to kind of by elimination, ruled out every possible explanation. So sometimes it could be a blood clot. If you've been sitting for too long, you have pain on your legs, a blood clot can form on your legs, and then as it breaks, it can go to your chest, and it became a pulmonary embolism. As we discussed in a prior video, you can have shortness of breath associated with a cough, with phlegm, and fever, so that's a pneumonia. If you're having shortness of breath when you're laying flat in bed, and you feel better when you're having 3 pillows, or when you sleep in a recliner, and you also have swelling on both legs, that shortness of breath could be because of heart failure. You can have shortness of breath from asthma, from COPD, which could be emphysema. You can have from pulmonary fibrosis. You can have something called pulmonary hypertension. So again, shortness of breath should never be attributed just to being out of shape until everything else has been ruled out. So please go see your doctor, get evaluated. Never assume that this shortness of breath is just from not being active, from being overweight. That could be the cause, but if we don't rule out other more serious conditions, it could be affecting your health even worse. So please go see your doctor if you're experiencing shortness of breath. Have a good day.